Good evening, and welcome to the Payne Bolton School of Nursing's Alumni and Friends Donor Appreciation Event. I'm honored to host this evening as Dean, and I'm excited to share a few of our school's highlights. Despite the physical distance that the COVID-19 pandemic requires, I'm grateful we can gather together virtually to celebrate the accomplishments of our FPB community. I'm also grateful for the generosity and engagement of our donors, which have opened doors to amazing opportunities for our students, faculty, and the nursing profession. Tonight, you will hear firsthand from our students and learn about our impressive research. And toward the end of the evening, we will be joined by Interim President Scott Cowan for a special announcement. Our founder and first leader of our school, Payne Bolton, was an incredible healthcare reformer. As a Congresswoman, her leadership created a legacy that has shaped history, as nurses have served through the challenges of war, pandemics, and social upheaval. Currently, our country is facing a global public health crisis and a renewed advocacy for healthcare equity and social justice. Whether on the front lines taking care of pandemic victims or in Congress advocating for the health and safety of the community, nurses continue to support the physical and mental health of individuals in our communities. Last spring, our FPB faculty, students, and alumni hit the ground running in the fight against COVID-19, providing frontline care, spurring contact tracing initiatives, and supporting community outreach efforts. As disruptive as COVID-19 has been, the world is seeing how vital nurses are to society. Our FPB community continues to respond swiftly by providing transformational leadership on many fronts. For example, from the start of the pandemic, infection prevention expert Dr. Shanina Knighton identified a need to communicate how to prevent transmission of the virus, specifically within lower-income African American neighborhoods of Cleveland. Communities of color have been disproportionately affected by the pandemic, and Dr. Knighton created how-to guides that cover everything from going to the grocery store, navigating shared spaces in apartment buildings, and advocating for one's own health care. Associate Professor Dr. Mary Delansky, recently appointed to the Sarah Cole Hurst Professorship, received CARES Act funding to support activities for the prevention, preparation, and response to COVID-19. As a director of the Quality, Safety, and Education in Nursing, or CUSIN Institute, Dr. Delansky is using the funds to develop telehealth, COVID-19 screening and testing, and COVID-19 workforce training. She also continues her groundbreaking work, funded by the John A. Hartford Foundation, to bring age-friendly healthcare to older adults in over 1,100 CVS Minute clinics across the United States. Through proactive prevention procedures, wearing masks, staying 6 feet apart, and filling out daily health attestations, a majority of our FPB community, including students, faculty, and staff, have stayed healthy and safe through the fall semester. We've maintained our use of the health education campus using a hybrid education model of socially distanced, traditional classroom and lab instruction, plus online classes and other activities, and of course, clinical work. Kudos to our faculty, students, and staff for their adaptability and patience. The Center for Nursing Education, Simulation, and Innovation was integral to our success to effectively shift student learning to a virtual format when we were forced to close the HEC due to COVID-19 in March of 2020. Our simulation team supported faculty as they developed online experiences, such as virtual simulations, demonstrations, and case studies to meet course objectives. Thanks to generous funding, we purchased high-definition video recorders, tripods, and editing software to create a virtual library for future education. As students were transitioned back to in-person labs in the fall, faculty offered Zoom sessions to include students who were in quarantine or unable to attend in person. The challenges of COVID-19 have strengthened and broadened our teaching strategies, enabling us to be creative, resourceful, and resilient. As a result of the difficult challenges spurred on by the pandemic, I launched the FPB Nursing Strong Together campaign to respond to students' needs. Thanks to your generous support, the campaign has raised close to $20,000 to date. The funds have been used primarily for personal protective equipment required by students at various clinical sites. Your donations have allowed us to equip students as needed with PPE as they rotate through various health systems and community settings. The clinical faculty and students are so grateful for your generosity in ensuring their good health. As our faculty and students have continued to excel throughout the pandemic, so too have our alumni. FPB alumni comprise a global network of practitioners, researchers, educators, and executives in almost 50 countries. Since the start of COVID-19, many of our nurse leaders have worked continuous shifts, spent months isolated from their families, and thousands have personally battled the COVID-19 virus. When Case Western Reserve began the planning process of becoming a point of distribution for the COVID-19 vaccine, more than 50 alumni and faculty volunteered to help vaccinate the CWRU and local communities. FPB's Associate Professor Dr. Elizabeth Click, also CWRU's medical director, has taken on the leadership role for directing our volunteer provider organization efforts. Locally, Dr. Jesse Hansky and Shannon Wong, along with other Bolton School faculty, have been volunteering at the Cleveland Public Health Department vaccination points of distribution. Our plan is for students to help in the vaccination efforts this spring. Our students' contributions extend the Frances Payne Bolton School of Nursing's reach to individuals and communities in the greatest need, helping us to achieve our mission of excellence in service to others. Riley Kennahan is an example of this service. She is a fourth-year nursing student at FPB. She works at the Cleveland Clinic main campus as a clinical technician in a medical surgical unit. Riley is also an avid volunteer. She has been a Girl Scout troop leader and currently delivers hot meals to older adults in the Cleveland community through the Benjamin Rose Institute on Aging, and she helps at the Greater Cleveland Food Bank. Additionally, Riley and classmate Angelina Scribano work as supplemental instructors and host 2 review sessions a week for nursing students. For the past 3 years, Riley has also worked as a student ambassador in the Department of Alumni Relations and Development, where she's met many generations of FPB-educated nurses. Riley is passionate about reducing health disparities through research and service. Riley joins us now to share a day in the life of a very busy FPB nursing student.
Hi, my name is Riley Kennahan. I'm a senior nursing student at Case Western Reserve University in the Frances Payne Bolton School of Nursing. So I thought I could try to take you all through my day and see what a day is like for me as a nursing student at Case Western. I'm in the classroom that I had one of my favorite classes in nursing school. This was my perioperative nursing course taught by Dr. Patton. I thought that this was an awesome class because a lot of nursing schools don't give their students the opportunity to get a perioperative course and also hands-on clinical experience right there in the operating room. Hi, I'm here in the clinical simulation lab, and here we have very realistic, lifelike models where we can practice our clinical assessments. Some things that I've practiced here include postpartum hemorrhage situations. I've practiced pediatric pyloric stenosis simulations. I've practiced blood draws. I'm here at the Cleveland Clinic. I just got off of a night shift. I work in the COVID NICU at main campus. I have felt so much more prepared to work in this kind of critical environment with my education and my training. Next up on my day, I'm out taking my dog Kelly for a walk. This is the first thing that I always do when I come back from a long night shift. Say hi, Kelly. Hi. I took my post-night shift nap, and now I'm ready to start my day. I have a cup of coffee with me here, a nursing student's best friend. So now I'm going to do some work for my nursing leadership course. I'm going to do a homework assignment that's due today. This is a reflection on the legal boundaries for nurses and also sources of nursing leadership. I'm finishing out my day-to-day at Neighborhood Family Practice on Ridge Road. This is a series of clinics that are primary care clinics where RNs get to give vaccinations, do health screenings, health appointments, and really get to practice to the fullest extent of their license. And I'm doing this clinical through the HRSA grant at Case Western, which is affiliated with the VA. To wrap up my day, something that I like to do is to try to take some time for myself, try to relax before I go to bed. And one way that I really like to do that is to read. So this book that I'm currently reading is called Just Mercy. This is a true story nonfiction, and it's about the story of a civil rights lawyer in the South.
Thank you, Riley, for sharing your experience. When Riley and other undergraduate students begin their nursing careers at the Frances Payne Bolton School of Nursing, they begin seeing patients after 3 weeks on campus. And so it was in the fall semester of 2020 when the class of 2024 began their clinical work. First-year BSN student Ariana Jefferson shares her insights into her first semester of clinicals at FPB.
My name is Ariana. I'm a first-year nursing student at Case, and I just got back from my clinical. If you don't know, clinicals are basically where you go to a hospital or another healthcare facility, and you get to practice skills on real patients, and kind of just get a feel for what the hospital setting is like, and get to talk to different healthcare professionals. It's a really cool experience to have in your first year because a lot of schools don't do this until your junior year, sometimes sophomore year, but having this experience as a first year is really beneficial to me, I feel like. So for example, today we went and took every patient's vitals on the floor, made sure they had lunch ordered, their linens were changed, and did baths as needed. And so there's just a couple of tasks that we can do as first years independently. And so Case is a great option for nursing if that's something that you're considering.
Thank you, Ariana. Now, I would like to introduce Dr. Ronald Hickman, the Associate Dean for Research at FPB, and one of our faculty members who participated in the COVID-19 transition team this past year. As the university was determining what a limited return to campus could look like, Dr. Hickman led the school's researchers through the challenges of the pandemic and devised plans with them to continue their work while staying safe at the same time. Please welcome Dr. Ron Hickman.
It is my pleasure to share with you an update on FPB's research and highlight our COVID-19 related projects. For fiscal year 2019-2020, FPB's faculty submitted 65 proposals to funding agencies requesting more than $51 million in research and training funds. 40% of our submitted grant proposals received funding, resulting in FPB's faculty receiving roughly $12 million in new grant awards. Impressively, our faculty earned $5.4 million from the National Institutes of Health, positioning FPB as number 10 among all schools of nursing in NIH funding. It should come as no surprise that in the face of the COVID-19 pandemic, that our research faculty, staff, and doctoral students continue to lead innovative research and educational initiatives. Despite all the adversity presented over the last 11 months, FPB's research community has shared its unmatched expertise to spur interdisciplinary COVID-19 related research and scholarship across the university and into our communities. Since last spring, we have submitted a total of 8 grants that focused on the effects of COVID-19 on student nurses, nurse executives, patients living with a chronic illness, and patients' families, caregivers. Although several of our grant submissions are still under review, we have acquired more than $600,000 in funding from local and federal organizations such as PCORI, the NIH, and HRSA. We have impressively received 94% of the funding that was requested for our COVID-19 related research. I'm proud to say that FPB's faculty continue to lead innovative research and projects related to COVID-19 that will inform the delivery of evidence-based nursing care now and well into the future. Truly, FPB is conducting research that is changing lives in practice. Next, Associate Professor Dr. Matthew Plow is a faculty member whose groundbreaking work is changing how care is delivered to patients with multiple sclerosis and their family caregivers.
Thank you, Dr. Hickman, for this introduction, and thank you also, Dean Musil, for the opportunity to be a part of this evening's celebrations. I'm honored to join you and to be virtually here to share with all of our FPB alumni, friends, and everyone watching this evening some highlights of my research. I have been a faculty member at FPB for over 6 years now. I have several programs of research on identifying strategies to support people with disabling conditions and their family. Most of my programs of research focus on people with MS, or multiple sclerosis. Multiple sclerosis is an autoimmune disease of the central nervous system with an unpredictable disease course. When diagnosed with MS, you are told that the disease may have an inconsequential effect on your life, or you may need to be using a wheelchair within a few years. As you can imagine, that this unpredictability can have a great psychological toll on the person that has it and their family members. Symptoms of MS are wide-ranging and depend on which nerves are affected. My most recent research has focused on symptoms of fatigue. Fatigue is one of the most common and debilitating symptoms of multiple sclerosis. It is different from how a healthy person experiences fatigue. It comes on quickly and has a lengthy recovery, and you can wake up fatigued even after a good night's rest. I first became interested in MS working as a clinician in a rehabilitation clinic in Williamsburg, Virginia. I was able to see firsthand many of the problems that people with MS can experience, and that there were few studies on how a person could self-manage their symptoms. At the time, most of the research was focused on the basic sciences to identify medications to treat and slow progression of the disease. Although this line of research is very important, it did very little to help people who were currently suffering with the disabling symptoms. As a graduate student at University of Minnesota, I had a very good friend who was diagnosed with MS. Unfortunately, the disease progressed very quickly with him, and he was no longer able to walk within a few years of having the disease. Watching the disease progress in him and seeing the impact on his family has had a long-lasting impact on me and renewed my dedication to a research career in helping people manage symptoms of the disease. Although this past year with the COVID pandemic has created many challenges, I'm also happy to share some of the accomplishments we have made in helping people self-manage the symptoms of MS. I was awarded a large grant, pre-pandemic, from PCORI, or the Patient-Centered Outcomes Research Institute, to examine the best ways to support people with MS manage fatigue. People with debilitating fatigue are often referred to occupational therapists, who are experts in helping people decide how they can conserve their available energy without giving up the activities that are meaningful and joyful to them. The purpose of our grant is to examine whether services delivered remotely, either through telephone or internet, can be as effective as being delivered in person. Research participants were randomized to receive occupational therapy sessions in person, over the phone, or through a website. As you can imagine, the COVID-19 pandemic made it very difficult to deliver the in-person sessions and conduct the physical assessments that were being used to quantify disability levels. So we adapted the in-person occupational therapy sessions and the physical assessment to be delivered through video conference. We recently determined that the physical assessments were valid and safe to administer. And we have recently received several requests from clinicians about the protocol so they can monitor progression of the disease in their patients. Although this is not easy to adapt and change these protocols, it aligns with our goal of demonstrating that services delivered remotely can be as effective as being delivered in person. These findings have substantial implications for the pandemic, as many healthcare services are now being delivered remotely as telehealth or telerehabilitation services. Because of our success of this ongoing study, we were fortunate this year to receive an additional funding from PCORI for a COVID-19 enhancement grant. In collaboration with Dr. Sarah Douglas, Assistant Dean of Research at FPB, we are identifying the best ways to reduce symptoms of anxiety and depression among unpaid caregivers of people with MS. We know that unpaid caregivers of people with MS experience high levels of anxiety and depression. This is probably particularly true during this pandemic. Unpaid caregivers are the invisible backbone of the healthcare system for people with MS and are now even more vital in the ongoing pandemic response as they support telehealth services and replace curtailed healthcare. Unpaid caregivers are often caring for people with disabling conditions who are at high risk for severe COVID illness. As a result, unpaid caregivers are under immense pressure to protect themselves from infection and to prevent transmission. This study aims to compare the effectiveness of highly tailored telecoaching intervention sessions delivered via video conference to a low-resource, web-only intervention on outcomes of depression and anxiety. We hope to complete this trial quickly and make the web-only intervention freely available if it is found to be effective. Because of these ongoing studies, we recently were awarded a training grant from the National MS Society. In collaboration with Dr. Ron Hickman, this training grant will support 3 postdoctoral nurse fellows to develop their own program of research. The training will provide nurse scientists with the skills to leverage advances in biosensors, ecological momentary assessments, and the remote collection of biomarkers to develop highly tailored self-management interventions. I'm very delighted to receive this grant, as I think it is very important to train the next generation of nurses to conduct interdisciplinary research in people with MS. That concludes my overview. Hopefully this gives you some insight into just one of the many research projects that we have been able to successfully continue during this last year. Thank you again for this opportunity to join you this evening.
Thank you, Dr. Hickman and Dr. Plow, for your updates about the impressive research our faculty are leading as we continue to advance nursing science here at FPB. As Dr. Hickman mentioned, we are fortunate for your support and the generous funding to enable us to accomplish significant milestones in our research. In addition to the critical research and Strong Together campaign funding, I'm pleased to report that FPB had a record-breaking fiscal year for philanthropic giving. We closed our year with close to $10 million in total giving, which included the FPB annual fund support of more than $400,000, truly a remarkable achievement. Your gifts, especially unrestricted support, give us the flexibility to be nimble and to respond to opportunities as they arise. I can't thank you enough for your support of our important initiatives and our amazing students and faculty. You are a huge part of our success. I am pleased to welcome a special guest to share our exciting news. Case Western Reserve University is incredibly fortunate to have Interim President Scott Cowan lead our campus community. He is President Emeritus for Tulane University, which he led for 16 years. Prior to his tenure at Tulane, he spent 23 years at CWRU's Weatherhead School of Management, serving as Dean for 14 years. Cowan's leadership and familiarity with CWRU has been instrumental in guiding the university through a tumultuous time. Please welcome Interim President Scott Cowan.
Thank you, Dean Musil, for including me in tonight's program. I want to congratulate the Francis Payne Bolton School of Nursing for an outstanding year full of great progress and success. I am pleased to have the opportunity to thank all of you for your exceptional support of and dedicated engagement with Case Western Reserve University. Today it is my great honor to announce a special gift from the Shaughnessy family that was made in memory of Marion Shaughnessy, beloved wife, mother, double alumnus from the Francis Payne Bolton School, nurse leader, administrator, community leader, colleague, and dear friend to so many. Please enjoy a short video that highlights Marion's legacy and the vision she created.
In 1985, Marion graduated from the master's program here at the Francis Payne Bolton School of Nursing. She developed the idea of a nurse leadership academy years later, while completing her doctorate of nursing practice degree at FPB. During Marion's time as a DNP student, she wrote a paper describing her vision for leadership in nursing. Individual and institutional partners quickly gathered behind her vision to establish the Marion K. Shaughnessy Nurse Leadership Academy at her alma mater.
As you all know, depending on whatever area you're in, you always have checklists. And why do we have that? We have that so we have certainty and we have quality. And what I found throughout time is that whether you call them goals or you call them checklists, it's very important to have certain things that you keep in your mind to keep you on target.
When we established the mission of the Marion K. Shaughnessy Nurse Leadership Academy, we were bold in our vision to create FPB as the leadership destination. We were bold in the design of our programs and projects. Leadership is the capacity to turn vision into reality. Marion Shaughnessy turned her vision into reality, and we are forever grateful to her.
Life isn't about finding yourself. Life is about creating yourself.
Marion certainly created a vision to fundamentally transform nursing and healthcare through nurse leadership, and she worked tirelessly to make that dream a reality. Today, the Shaughnessy family continues to work closely with the Marion K. Shaughnessy Nurse Leadership Academy's esteemed director, Dr. Joyce Fitzpatrick, and many other nurse leaders nationally to bring Marion's vision to life by promoting her values and implementing innovative educational programs for nurses at all levels. We are grateful to her husband Mike and daughters Ann and Kate for their ongoing commitment to Marion's vision to ensure that nurses and nurse leaders are at the forefront of providing premier health care. Tonight is my great honor to announce the remarkable and generous gift of $2.5 million to establish a new home for the Shaughnessy Academy in the Sampson Pavilion at our health education campus. This new commitment ensures Marion's vision is fulfilled in a collaborative and welcoming space. As you can see, the new space will provide a dedicated home on the third floor of the Sampson Pavilion, which will serve to elevate the visibility of the Shaughnessy Academy. Additionally, this gift will allow students, faculty, community, and national leaders to collaborate in a space dedicated to idea sharing and growth opportunities. On behalf of Case Western Reserve and the Francis Payne Bolton School of Nursing, I congratulate the Shaughnessy family, Dean Carol Musil, Dr. Joyce Fitzpatrick, members of the National Advisory Board and Founders Circle, and our dedicated alumni nurse leaders, donors, and friends for continuing Marion's legacy and advancing nurse leadership. Your support in Marion's memory will help sustain that momentum for untold numbers of future nurse leaders. They, too, will be equipped with the leadership skills she personified. We look forward to celebrating the many future accomplishments that will result from this wonderful gift. I'd like to close by thanking the Shaughnessy family for demonstrating such generous support. Additionally, I'd like to thank everyone gathered for this event for your unwavering commitment to the Francis Payne Bolton School of Nursing and to Case Western Reserve University. Now I'd like to introduce Ann Shaughnessy, oldest daughter of Marion and Michael, to say a few words on behalf of the Shaughnessy family. Following her mother's example, Ann is an accomplished leader in her profession as Vice President of Digital Products at Accenture and continues to support her mother's vision for nurse leadership as a member of the Marion K. Shaughnessy Nurse Leadership Academy Advisory Board and as co-chair of the board's marketing committee. Welcome, Ann.
On behalf of our family, thank you, President Cowan, for your kind words and for the commitment by you and the university leadership to partner with us. And a special thanks to a variety of individuals and organizations, such as Dean Musil, Dr. Fitzpatrick, my fellow advisory board members, FPB faculty and staff, the broader nursing community, devoted friends, and extended family for continued commitment to the Nurse Leadership Academy that bears our mother's name. It was important for my mom to align her academy with the Case Western Reserve University and its nursing school, which has proven to be a destination for leaders, starting with a great leader in her own right, Francis Payne Bolton. My mother had an amazing vision in creating a pathway for nurses to cultivate and advance their acumen for leadership. Her passion for elevating nurse leaders and quality healthcare was evident in everything she did and throughout her career. We are committed to carrying out my mother's dream, and we're excited to support a new home for the Academy in a space that offers incredible visibility, collaboration, and innovation. With the wonderful engagement and generous support of so many, we look forward to continuing the critical work she spearheaded to empower nurse leaders for generations to come. Thank you.
Thank you, President Cowan, for helping us share and celebrate this wonderful news. And a huge thank you to Ann, Kate, and Michael Shaughnessy for partnering with us as we continue to build upon Marion's vision. Your family's support and commitment is deeply appreciated and instrumental in the success of the Marion K. Shaughnessy Nurse Leadership Academy. This is an exciting time for our School of Nursing. To To explain further about the mission of the Marion K. Shaughnessy Nurse Leadership Academy and what this gift will mean for our future nurse leaders, please welcome Dr. Joyce Fitzpatrick, the inaugural director of the Academy and distinguished university professor.
Thank you, Dean Musil. On behalf of the Marion K. Shaughnessy Nurse Leadership Academy, I want to add my sincere thank you to the Shaughnessy family for this perfect gift at the best possible time. Just as we are all recovering from the at-home restrictions of the COVID-19 pandemic, the Marion K. Shaughnessy Nurse Leadership Academy will have a new home, a wonderful space in Sampson Pavilion. And thank you again to Marion Shaughnessy, who, building on the legacy of our first benefactor, Frances Payne Bolton, had the vision to challenge us to create FPB as the leadership destination for nursing nationally and globally. Let me share with you a glimpse of important leadership initiatives we have launched in the past year, and a few in the planning stages. Through the generous support of the Samuel H. and Maria Miller Foundation, we have launched both a pre- and a postdoctoral program to prepare executive nurse leaders. 11 Miller Fellows are part of the postdoctoral program under the leadership of Dr. Linda Everett. The first cohort includes 4 international fellows and 7 fellows from across the U.S. On behalf of the Miller Fellows, let me share a brief message from Dr. Katrina Heffernan from Tralee, Ireland, a member of the inaugural class. Dr. Heffernan is a nurse leader who is passionate about empowering the next generation of nurses to lead healthcare in the future.
My name is Katrina Heffernan, and I am so grateful to the Shaughnessy family, to the Marion K. Shaughnessy Nurse Leadership Academy, and to the Miller Foundation for giving me this opportunity to be part of this executive leadership program. I am so honoured to be part of this inaugural class. It has been a phenomenal journey contributing to my growth in leadership. The program has encouraged me to reach out to leaders who in the past I admired from a distance, but now they are mentoring me on this program. Marion wrote in a letter that 90% of leadership is based on relationships, and this legacy lives on within this program because I now have 11 new Miller Fellow friends from across the globe and access to global nurse leaders who facilitate on this program. Thank you so much for these opportunities.
The Miller Foundation also provided support for our Miller Scholars, 13 individuals who recently entered a new nurse executive track in the Doctor of Nursing practice program. On behalf of the Miller Scholars, I would like to share a video from the cohort coordinator, Melissa Cole, a senior executive nurse at University Hospitals of Cleveland.
As I think about Nurse Shaughnessy and her legacy and her inspiration to us is to be nurse leaders that can be invited and sit at multiple tables with executives and others and be able to articulate the value nurses bring to our institutions, our patients, and our communities. This academy will help us continue to be better prepared and more confident in sharing our perspectives and making a difference. Thank you.
In March 2021, through generous support from Arnold and Wanda Coldiron, we will launch an Executive Senior Nurse Fellowship Program in collaboration and partnership with 3 major nursing organizations: the American Nurses Association, the American Organization for Nursing Leadership, and the Healthcare Financial Management Association, and the Weatherhead School of Management at CWRU. Marion Shaughnessy was part of our initial planning for this program and was so committed to its launch, paving the way for senior nurse leaders to assume groundbreaking leadership roles globally. Just as we now have Rear Admiral Susan Ortega, a nurse, recently appointed Interim Surgeon General of the United States, there are opportunities for nurse leaders to carve new avenues in healthcare and beyond. This Cohort Fellowship Program will expand our boundaries and fulfill Marion's vision. 21 Cohort Fellows will begin the year-long program in March 2021. They represent a diverse group of nurse leaders from academia and care delivery, from the largest public health system in the U.S. to a community hospital in rural Texas. Among our Cohort Fellows is the current president of the Philippine Nurses Association of America, Dr. Mary Joy Garcia-Dia, who also is receiving support from the Justly Project, and Dr. Eric Martin, president-elect of the American Organization for Nursing Leadership. I want to share with you a few messages from our Cohort Fellows.
Hi, I'm Eric Martin, and I'm the Vice President and Chief Nursing Officer for Norton Children's Hospital in Louisville, Kentucky. I'm also the President-elect for the American Organization for Nursing Leadership. Today, I want to thank the Shaughnessy and Cohort family for your generous sponsorship for the Cohort Executive Nursing Fellowship Program. I couldn't be more excited to participate as an inaugural fellow in the 2021 program. This comes at a great time for me as I prepare to assume the role of the president of AONL, our nation's largest organization for nursing leaders. I look forward to soaking up as much knowledge as possible, and maybe most of all, to building lasting relationships with nurse executive colleagues from across the globe. Sincere thanks for this awesome opportunity.
I'm excited to represent rural healthcare, to learn, to grow, and to forge lasting relationships with like-minded healthcare professionals whose goal is to make our profession patient-centered, cost-effective, accessible, and quality-driven. The foresight and philanthropic spirit of Marion Shaughnessy to found and develop the Nurse Leadership Academy so that nurse leaders such as I can gain the knowledge to shape and change the future of healthcare was so visionary. Thank you seems so underwhelming to express my appreciation for investing in me and the future of nursing, but thank you from the bottom of my heart. This opportunity is not only career-changing for me, but life-changing. Again, thank you ever so much.
I want to express my sincere appreciation to the Cohort family for their generosity and support that will allow me to participate in the Senior Executive Fellowship Program. I am excited to be a part of this program because it will allow me to expand my knowledge and skills in leadership. This journey will also allow me to bring meaningful changes to my career by opening up opportunities and building relationships that will allow me to make positive change. I'm truly looking forward to experiencing the wealth and knowledge the 4 partner organizations have to offer, and I want to thank you again for this extraordinary opportunity.
And last but not least, I would like to share with you our latest project, the creative idea of my colleague, Dr. Mary Beth Modick, a nurse leader at the Cleveland Clinic and a former student of mine. Mary Beth's dream was to share the value of nursing and the accomplishments of nurse leaders with the nation's children. And so, putting our energies and talents together, we have written a children's book for middle school-age children, profiling the accomplishments, sometimes against all odds, of 50 extraordinary historical nurse leaders. Our book is titled Luminaries of the Past, Stories of 50 Extraordinary Nurses. Of course, we begin the book with Florence Nightingale, the founder of modern nursing. We begin the book in 2020, the World Health Organization designated Year of the Nurse and Midwife in honor of the 200th anniversary of the birth of Florence Nightingale. And just this week, Mary Beth and I received a wonderful invitation. We will participate in a virtual webinar through the Cuyahoga County Public Library on May 12th, 2021, Florence Nightingale's birthday. Our virtual event will be announced to the library's 300,000 subscribers and featured on the library's website for upcoming events. Do check out the website, beyondbookjackets.com. Nurse leaders will soon be featured there. The book will be available for purchase in March 2021. Importantly, all of the royalties will go to the Marion K. Shaughnessy Nurse Leadership Academy. Marion's dream has led us forward, always toward the goal of empowering nurses at all levels as leaders of healthcare. Nurses caring for patients at the bedside and nurses creating policy at the highest government and corporate levels. A number of you have contributed to our mission financially and intellectually. I also want to acknowledge and extend a special thank you to our Founders Circle, a group of 40-plus graduates who invested their financial resources early in the launch of the Leadership Academy. Many of you knew Marion personally, and her love of life and nursing resonated with you. Thank you. In conclusion, let me draw a few historical parallels. In 1923, Frances Payne Bolton endowed the Case Western Reserve University School of Nursing, and at that time she remarked that the school should be free at all times in the future to engage in other experiments to cooperate with hospitals in these efforts. Marion Shaughnessy so admired the legacy of Frances Payne Bolton, and the initial gift of Marion and Mike Shaughnessy and the recent commitment of the Shaughnessy family for this beautiful space will lead us to engage in other experiments and, importantly, to position FPB as the leadership destination for nursing and healthcare.
Thank you, Dr. Fitzpatrick, and my sincere thanks to the Shaughnessy family, once again, for continuing to support Marion's vision of advancing nurse leadership. At the hallmark of our mission, starting with Frances Payne Bolton, a strong leader in her own right, is the creation and empowerment of nurse leaders who develop and implement innovative and interprofessional research, education, and practice activities that make a positive difference in the health of individuals and communities. It is this critical concept of leadership that we've come to value most, especially during this past year. Whether on the front lines, serving our communities, conducting critical research, educating our amazing students, volunteering on boards and leadership committees, or generously supporting our FPB Nursing Strong Together campaign, our entire FPB community continues to lead, respond, and adapt, ensuring Frances Payne Bolton School of Nursing remains one of the top nurse leadership destinations. In closing, I extend my heartfelt thanks to each of you for being here this evening and for your ongoing support of the Frances Payne Bolton School of Nursing. As alumni, friends, and faculty, you have helped to make FPB what it is today. You are our partners as we continue to lead the way for a bright future. The opportunities on the horizon are limitless, and I welcome your continued engagement. Thank you.